Hi, Mike here, and welcome to this video. This video is going to explain the health condition that I have and basically give some background as to how I got to where I am right now. So in short, I'm waiting now for heart surgery, and I am going into hospital next week to have fairly significant heart surgery to replace a defective heart valve, the aortic valve. So I thought it would be useful to give some sort of background as to my journey to getting to where I am right now, which is just over a week away from having major heart surgery. So the background to this, I suppose at the beginning, when did I first realise I had a problem with my heart? I was just turning 40, I was buying a house. At the time I lived in Australia and I wanted to get some life insurance. I was married at the time and I wanted to do the right thing and make sure that my then wife at the time was protected if anything happened to me. Taking on a big commitment as a mortgage, and as you do, you want to make sure that you're covered. So the life insurance company I selected, they insisted on a medical. So I went for this medical, and the doctor who examined me, he noticed a irregular sound in my heart, which turned out to be a murmur. This was investigated by a cardiologist who at the time said I had mild regurgitation, which is basically the valve not closing properly and allowing a little bit of blood to go backwards through the valve, making the irregular sort of sound that they were hearing. I was told at the time that it wasn't going to be an issue. It was mild in its nature, and probably over the next several years it would probably need to be monitored at some time in the future, but it was of no concern at that particular time. So skip forward around 10 years and it was 2020, just during the pandemic, and I was planning on returning back to the UK. I was going through a lot of stress at the time. I wasn't sleeping particularly well, waking up in the night with cold sweats and just felt terrible. So I just put it down to anxiety. I went to the doctor, asked the doctor to give me something to help me sleep and maybe take the edge off my anxiety, and he checked my blood pressure, and my blood pressure was dangerously high. I mean, like 180 over 220. It was ridiculous. He was very concerned, and even after him taking the blood pressure several times after that, it was still dangerously high. He immediately put me on blood pressure medication. Bearing in mind I was about to fly back to the UK, so I was flying back to the UK about a week later, and obviously there was nothing that they could do in Australia for me at that point in terms of investigating the cause of the problem. So he just said, basically, when you get back to the UK, first thing you need to do is get yourself to a doctor and start getting them to investigate the cause of this high blood pressure. I was on this blood pressure medication. I went out and bought myself a blood pressure monitoring cuff. My blood pressure did start to come down on the medication, which was a relief. And having returned back to the UK, I immediately went to get a doctor and made an appointment, explained the background with the heart murmur and the symptoms, and they did some checks and immediately referred me to a cardiologist. And the cardiology department I went to was in my local hospital, and the first couple of tests they did were echocardiographs, which is basically they listen to your heart and they take images of your heart using ultrasound, and they can basically see what's going on with the mechanics of the heart using that method. The cardiologist reviewed the information that was provided by the technician, and they called me back to do an echocardiograph again, but this time with stress. So they put you on an exercise bike, they do the same, basically the same thing again. They listen and look at the heart. While your heart's under load, they can actually take images of the various valves and take measurements of the opening and closing of the valves, and make an assessment as to what's going on with the heart. After several weeks, I received a letter from the cardiologist basically explaining the diagnosis. I was diagnosed at that time with aortic stenosis, moderate in brackets, moderate being in the middle of the range in terms of the severity. And that was the diagnosis. There couldn't be any more detail than that. There was a load of data in there which I didn't understand. So some time passed, and I was told that I would be on the heart valve watch list. In other words, they get me back on in regular intervals to monitor the condition, because it's a degenerative condition. Obviously, since the initial murmur was detected, 10 years or more had passed, and the condition had deteriorated. So that is the nature of the condition. Over time, it does get worse. So fast forward to 2022 now. I'd been under monitoring. The condition hadn't been diagnosed to be any worse, and then I was still active. I was still able to do a lot of the things that I was doing prior to the diagnosis. So I was still doing a lot of walking and running and cycling. And on this one particular occasion, I was running with my running group. I belong to a running group, and I just completed an 8-kilometre run. And at the end of the run, I started to feel lightheaded and dizzy, and I passed out. I woke up or come round with faces staring down at me and asking if I'm alright and do I need an ambulance and is there anything they can do for me. I explained that I had this pre-existing condition, but I felt fine. I got up, I had some water, and within a few minutes I felt fine. But I did let the cardiologist know. So I spoke to the cardiologist's secretary and I said, look, I had this event and does it need to be investigated? Well, yeah, they did. They got me back in fairly quick, and they did another echocardiograph. They also did another stress test, put me on a blood pressure monitor, and then the cardiologist supervised the echocardiograph this time and had a proper look at the image himself, and that's when the diagnosis was starting to become a bit clearer. I had what is called a bicuspid aortic valve. So an aortic valve has 3 leaves, and in some cases the 3 leaves sometimes they're not fully formed, or you might have one that's partially fused and you end up with just 2 leaves or 3 leaves that don't fully open, is the way it was explained to me. So anyway, the cardiologist explained that it would get worse, and some of the data he was seeing was suggesting that I was moving into the severe category. Not fully severe, but some of the readings he was seeing were in the severe range. So the deterioration had stepped forward a little bit more. Having discussed it amongst his colleagues, he's part of a panel of cardiologists, and they discuss each case and determine what's the suitable course of action. It was decided that it was time to get me referred for surgery, and that's where I found myself at the beginning of this year. I was contacted by the surgical team at Wivenshaw Hospital to go and meet the surgeon, and also to prepare for the pre-operative assessment. So that started in January. So one of the tests I had to go and do was I forget what they call it. I'll just refer to my notes. It's called an angiogram. Yeah, angiogram. They basically feed a little fine wire and a tube up through the vein in your wrist, which goes all the way to your heart, so they can inject a dye into your heart or in the area of your heart, so they can see if all of the arteries and the major blood vessels in the heart are clear. Because what they want to find out is, while they've got your chest open to replace the heart valve, is there going to be any other work needed in there? Like my mum, when she had her aortic heart valve replaced, she also had a triple bypass. So that's two separate things that had to be dealt with in one operation. In my case, I'm fortunate my arteries around the heart are clear. So besides my dodgy heart valve, I've generally got quite a healthy heart, although I have been told that it is a little bigger than it should be, but that's a function of the hard work my heart has to do in order to do its job now, because of this defective heart valve. So so that's where I find myself. So, you know, what do I think about it? Well, for the last 10 years since I found out I had the heart murmur, I've done everything I can to try and stay fit and healthy. I took up running. I was very active in Australia in running park runs and half marathons and 10k runs and trail runs. I did several obstacle races, Tough Mudders, Spartan races. I completed the trifecta in Spartan race, which is all 3 distances in one season. And I also took up martial arts to manage some of the stress in my life, and hopefully give me a better outcome long term. And I got my black belt in 2016, so I've always been pretty active. So to find myself where I am right now, where the doctor has basically told me I should really not be doing any really strenuous exercise, I've had to take my foot right off the gas in terms of what I normally enjoy doing, and that is partially why I've not been so active on YouTube, because a lot of the stuff that I've been posting up in recent years was you know, fairly big hikes and stuff like that, which I haven't been doing, because I on these sort of longer walks I get out of breath. I can't walk as far as I used to in terms of the big climbs and long distances, so I've not been doing it this last 12 months. So so yeah, that's where I am. And so how do I feel about it? Well, I'm fairly sort of pragmatic about it. You know, it needs to be done, and it's going to bring me back to where I was before I started to feel sick, and hopefully I'll be back to where I was maybe 10 years ago in terms of my heart fitness and what my heart can do in terms of supplying my limbs with oxygen when I do the things I want to do, like running and stuff like that. So what am I having? I'm having the aortic valve replaced, and I've opted for, and this was a discussion I had with the surgeon, was what type of valve I was going to have. There's 2 types available to me with my condition. One is a tissue valve, which is based on bovine material, so it's animal based, or the other option is a mechanical valve. There's pros and cons with both. I guess the biggest con with the tissue valve is it's not as durable as a mechanical valve. But the positive is I don't have to be on medication for the rest of my life. With a mechanical valve, you have to monitor your what they call your, I think it's the INR, international numbers. It's something to do with the time it takes for your blood to clot and form a clot if you have a cut or you injure yourself. It's like a blood thinner. It prevents clots around the new valve because you've got this foreign body in your heart. There is a risk that clots can form around it, and then a piece of this clot can break off and it can lodge itself in your brain or somewhere else, and you can die of a stroke. It's that simple. So you have to be on medication, usually some sort of warfarin based drug, which slows down the clotting process. But because of my active lifestyle, I didn't want to be on a medication that could potentially mean that if I do have an injury, like a sporting injury, I come off my bicycle or something like that, I don't want to have a significant bleed. So I made the decision to have a tissue valve. The beauty of the tissue valve being that it does last about, they reckon, between 10 and 15 years. And then at that stage they can just insert a new valve in that valve using a procedure called a TAVI, which is trans-aortic catheter insertion. I think that's what it stands for. So they basically put the new valve in through a tube that they feed up through your groin. They basically use an X-ray to see the positioning, and then they can insert it in the valve that they're going to put in me. So basically they can upgrade, I guess that's how I see it, they can upgrade the valve they're putting into me now, they can upgrade that down the line, so I don't have to have as invasive surgery as this time. This time I'm going to have the full zipper. They're going to basically open my chest up, stop the heart, do the surgery, make sure everything's okay, then restart the heart and sew me back up again. And I think it takes about 5 or 6 hours, this surgery, to complete. And for a significant part of it, my heart is going to be stopped. Obviously they have to stop the heart to work on it, and I'll be on an heart-lung bypass machine, so there'll be a machine in the corner that'll be doing everything that my heart and lungs normally does. So yeah, I'm not, I wouldn't say I'm nervous about it. I've had surgery before, not as invasive and certainly not as life-saving as this. But it is going to be a long recovery. I'm probably looking at about 3 months rehabilitation after surgery to get me back to full fitness. Certainly the first 6 to 8 weeks is going to be the hardest, because I'm going to have to deal with the pain and discomfort of the fact that they're opening me up straight through the sternum. So I'm going to have discomfort for quite a while, and living in my van, which I do, is going to be difficult. So I'm going to be staying with my sister for a little while, and then eventually when I'm able to look after myself, I'll move back into the van, but it'll be on a caravan park for maybe a month or so until I'm cleared to drive again. So so anyway, that's where I'm up to. So that I think I'll just wrap this video up there right now, and I'll probably do another one next week as I get a little bit closer to the day, which is the 12th of October when the surgery is happening. So I'll probably have a few thoughts and reflections on how I'm going and how I feel about it, and you know, what sort of anxiety or nerves I'm feeling, and then after that it'll be after the surgery, and then and then my recovery afterwards. So I'm going to do this as a series. So this one's just basically, you know, explaining what it is and what's happening, and then we'll go from there. So I hope that this video has been informative. I hope that there are people out there who are in the same position as I am, or just starting the journey, will look at this video and get some kind of insight into what I'm going through, and maybe take something positive away from it. It hasn't up to now, it hasn't stopped me living my life. It hasn't stopped me from being able to do the things that I want to do. I've had to slow down, and the next few months is going to be very crucial in my recovery. But I think I've done the right things. I've tried to stay active, so hopefully my recovery is going to be good. But anyway, I'll leave it there. I don't want to waffle on too much. So again, if you've enjoyed this video, please give it a thumbs up, give it a like, and if you're not subscribed, please consider subscribing, and tick the little bell icon so you get notifications every time I upload a new video, because I think this series is going to be of benefit to other people, like I say, who are going through this condition themselves, and give them something to you know, so then they know they're not alone. Okay, thank you, and I'll see you later. Bye.